Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How expectorants work on coughs. An expectorant is a type of cough medicine that thins and loosens mucus. These medications are typically used for managing chest congestion, especially when symptoms are caused by a lot of mucus. /r/n/r/n expectorants are a mucoactive class of drugsthose that clear mucus from the airways. Guaifenesin is the most common expectorant and is found in inMucinex 404 and Robitussin. /r/n/r/n In addition to over-the-counter, OTC, liquids, pills, and tablets, there are natural remedies that some people use to thin mucus and relieve congestion. /r/n/r/n expectorants are commonly used for symptoms of short-term, acute, respiratory tract infections, like the common cold, pneumonia, or bronchitis. /r/n/r/n These infections can cause a buildup of phlegm in your throat or lungs. Expectorants thin this phlegm. Once it's loosened, you can cough up the excess mucus, making it easier to breathe. /r/n/r/n expectorants can make you more comfortable, but they do not treat the underlying cause of chest congestion. You may need to use another treatment with an expectorant such as antibiotics to clear up the illness that is making you congested. You may also need a steroid to reduce inflammation to ease symptoms. /r/n/r/n There are many brand name over-the-counter, OTC, products and prescriptions that use different types of medication. /r/n/r/n An expectorant helps with a wet cough, breaking up mucus so you can breathe better. If you don't have phlegm but feel stuffy in your nose and sinuses, a decongestant is better. This will shrink swollen tissue so you can inhale freely. /r/n/r/n Some home remedies can act like an expectorant to thin secretions. However, there is limited evidence supporting their effectiveness in treating cough and congestion. /r/n/r/n Studies of natural remedies may include only animal tests and others consist of small human trials. Do not discontinue prescription medications, and talk to your healthcare provider before using alternative treatment. /r/n/r/n Examples of natural expectorants include /r/n/r/n Remember, while many natural cold remedies are considered safe in general, they may not be safe for you to use depending on your health and the medications you take. Always ask your provider or pharmacist before you try a natural remedy or supplement. And consult a healthcare provider if your cough does not get better after you've been treating it at home. /r/n/r/n Sometimes, expectorants are used to manage congestion associated with chronic respiratory conditions like chronic obstructive pulmonary disease, COPD or emphysema. If you have a chronic respiratory condition, you should not use an expectorant unless your healthcare provider recommends it. /r/n/r/n Guaifenesin has been explored in the management of fibromyalgia, but researchers are not sure why it might help and providers do not officially consider it a treatment for the condition. /r/n/r/n Talk to your provider before using an expectorant if you are pregnant or breastfeeding. If you have developed any type of allergic reaction or intolerance to expectorants in the past, you should not use them. /r/n/r/n You should also be careful when driving or using machinery while you're taking an expectorant because the medications can make you drowsy or dizzy. /r/n/r/n Expectorants often come as combination medications. It's important to read the labels carefully and make sure you know what all the ingredients are. Even if you can safely take an expectorant, there might be other ingredients in the product that would not be safe for you to take. /r/n/r/n Some combination medications also have pain-relieving ingredients in them. If you are already taking another pain reliever like Tylenol, check if the cold product has any pain medicines in it to make sure you don't take too much. /r/n/r/n If you're taking an expectorant, follow your healthcare provider's or pharmacist's instructions. Always read the medication package carefully and make sure you understand them. /r/n/r/n Follow these general guidelines. /r/n/r/n Expectorants do not commonly cause serious side effects. The most common side effects of expectorants include dizziness, drowsiness, and rash. /r/n/r/n Combination expectorants are more likely to cause side effects. Dextromethorphan, the main ingredient in Robitussin DM and Mucinex DM, can cause drowsiness, dizziness, nervousness, restlessness, nausea, and vomiting. /r/n/r/n Expectorant medications are sometimes combined with dextromethorphan, a drug that may lead to dependence and can also be a drug of abuse. /r/n/r/n Phenylephrine, found in mucoactive, can cause high blood pressure and a slowed heart rate, bradycardia. The drug can also interact with antidepressants and heart medications. /r/n/r/n Your provider might suggest you take an OTC expectorant to help clear up congestion because these medications work to thin mucus and make it easier to cough up. /r/n/r/n There are many expectorant products to choose from, and some have other medications that help with common cold symptoms in them, too. Check the labels carefully and know all the ingredients that are in a product you plan to take. You should always check with your provider or pharmacist before starting an expectorant. /r/n/r/n Keep in mind Fathom remedies for a cough and cold can also help you feel better. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.